Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 11th, 2025. This video is on a New England Journal of Medicine review article published on October 2nd, 2025, titled Monoclonal Gammopathy of Undetermined Significance. What is MGUS? Monoclonal gammopathy of undetermined significance, or MGUS, is a pre-malignant plasma cell disorder with monoclonal proteins in blood but no end organ damage. How common is MGUS? It affects about 5% of the people over age 50, with higher rates in older individuals and those of African ancestry. How is MGUS detected? Often incidentally during evaluation for unrelated symptoms using serum protein electrophoresis or mass spectrometry. What is the risk of progression? Approximately 1% per year risk of progression to multiple myeloma, Waldenstrom's macroglobulinemia, and other cancers. Are there different types of MGUS? Yes. IgM MGUS, non-IgM MGUS, and light chain MGUS, classified by the immunoglobulin secreted. What are the diagnostic criteria for MGUS? Serum monoclonal protein less than 3 grams per deciliter, less than 10% clonal plasma cells in the marrow, and no end organ damage or CRAB. Can MGUS cause symptoms? Not directly, but related disorders like MGCS can cause significant organ dysfunction. What is MGCS? It's monoclonal gammopathy of clinical significance, disorders where the M protein causes non-malignant but serious diseases. What is CRAB criteria? Hypercalcemia, renal dysfunction, anemia, and bone lesions, used to assess progression to multiple myeloma. Is treatment required for MGUS? No treatment is needed. Monitoring depends on risk stratification and progression signs. How is it risk stratified in MGUS? By M protein level, type of immunoglobulin, and abnormal free light chain ratio or FLC ratio. What are the signs of MGCS, that is monoclonal gammopathy of clinical significance? Kidney disease, neuropathy, skin disorders, and coagulopathies linked to the M protein. What's the light chain MGUS? A subtype where only free light chains are secreted with intact immunoglobulins. How is MGUS monitored? Labs repeated at 6 months, and then based on risk every 1 to 2 years if stable. Can MGUS affect the kidneys or nerves? Yes, through monoclonal gammopathy of renal significance and monoclonal gammopathy of neurologic significance. Both are part of the monoclonal gammopathy of clinical significance spectrum. Eponyms in MGUS and plasma cell disorders. Jan Waldenstrom described macroglobulinemia and recognized monoclonal proteins in 1950s. Robert Kyle coined the term MGUS in 1978 and established its pre-malignant nature. Fabrice Brideau and Nelson Leong co-developed monoclonal gammopathy of renal significance criteria and IKMG guidelines linking renal pathology to monoclonal gammopathy. POMS syndrome, an acronym, polyneuropathy, organomegaly, endocrinopathy, M protein, and skin changes. Schnitzler syndrome, chronic urticaria, and IgM monoclonal gammopathy described by Lilly and Schnitzler. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.